Hello, my name is Samantha Teachin. I'm a Weber State University Nursing School student, and I'm here to talk to you today about transgender health concerns. So first off, who are transgender people? Transgender people are people that use the term transgender as a way to describe their gender identity, which was different than what was assigned at birth. For example, there's people who are male who transition to female, female to male, and then non-binary, which is kind of a in-between place where you don't really identify as either male nor female. Some people choose to transition using surgeries, hormone replacement therapies, changing their name, changing their sex on legal documents, etc. Some choose not to do any, or some choose to do something kind of in between. It is really just a personal experience and is very different for everybody. So as far as Utah goes, the transgender community account for about 0.36 of Utah's population, or about 7,200 people. As far as the United States is concerned, it accounts for about 1.4 million adults. Most of those, however, between the ages of 18 to 24, and there's about 25 million people who identify as transgender worldwide. So as far as America is concerned, America accounts for about 5% of the world's transgender population. Let's talk a little bit about the social determinants of health in transgender people. So transgender people have a lot of difficulty with a lot of social determinants of health. Their social environment, their physical environment, and their access to health services can be really poor and a lot different than those statistics compared to the rest of the community and the rest of the United States. For instance, the social environment. So hate crimes are reported in about 21% of transgender people based on their sex orientation or gender identity, and 9% of trans people report being physically attacked in the last year. 55% of trans youth report being verbally harassed in school. The physical environment for transgender people is statistically quite different from the rest of the U.S. population as well. 29% are statistically thought to live in poverty compared to 14% of the U.S. population, 15% unemployed compared to 5%, 30% have a lifetime homelessness compared to just 12% of the U.S. population. And as far as housing goes, 27% are less likely to be shown additional homes, with 9% more likely to be quoted homes at a higher price than what was originally listed. There are quite a few barriers and determinants of health when it comes to health services as well. There's a lower rate of prevalence of healthcare screenings in the transgender community, really basic stuff, just like being screened for cancers, being screened for STIs, your regular annual checkup appointments, and they are less likely to have health insurance as well. There was just a transgender health protection reverse just this year, pretty much so stating that trans people could be denied health insurance, could be denied care. For example, a trans man could be denied for treatment of ovarian cancer through his insurance. Stuff like that kind of being done throughout the community as far as health is concerned. And 70% of transgender patients report being refused necessary care. So these are kind of the barriers and the social determinants of health in the transgender community. As you can see, there are quite a few. There's a lot of things going on. All right, so as I said before, this population is disproportionately affected by social physical environment as well as access to health care. And like I said before, there are national and state laws now in reversal towards health protections, health insurance, things like that. As you can see, there are two maps on this screen. The top one shows discrimination against employment. The dark blue ones are everywhere where a state law prohibits discrimination based on sexual orientation and gender identity, which account for about 20 states. And then the lighter colors have no explicit prohibition for discrimination based on sexual orientation or gender identity, which accounts for 26 of these states. And then the other 5 states are just kind of in between, so you can see that map there. The map below shows places where public services are not standardized, or are standardized, or where there are laws in place. So there are state laws in 19 states that prohibits discrimination based on sexual orientation and gender identity for the use of public services. There are 27 states that are the light colors that don't have any prohibitions against the discrimination based on sexual orientation in state for the state law. And then the other 5, again, are somewhere in between. So where does the transgender community fall in the Maslow's hierarchy of needs? So there are quite a few needs that the transgender community is not meeting fully. They have their physiological needs met. They have food, water, sleep, homeostasis, excretion, those basic needs. However, there are unmet needs as far as safety, love, belonging, esteem, and self-actualization goes. There is not a security of employment, resources, family, or healthcare. A lot of transgender people are discriminated against and left behind by their families, so there's not a lot of love and belonging within the families sometimes. And the amount of hate crimes makes it really difficult to gauge the amount of respect by others and respect to others that the transgender community has. So these based on the Maslow's hierarchy of needs, the health outcomes for the transgender community are rather low, based on their high levels of poverty, unemployment, their lack of accessibility to health care, and many other things can contribute to the low functional level for the transgender community as far as the Maslow's hierarchy of needs goes. As far as communicable diseases or infections goes, there's a couple of different risks that the transgender community faces, including injection infection for sharing other hormone injections or needles with their friends based on lack of access to those. There's an astonishing amount of the transgender community in sex work. 27% of trans people worldwide have participated in some kind of sex work, which increases their likelihood of having STIs just due to multiple partners, a lot of the times lack of proper protection in the sex work community, as well as they're just participating in high-risk sex. So trans people are 49 times more likely to be living with HIV, and a lot of them don't even know it. And a lot of the reasons that I could find and why they weren't being treated for HIV is either that they don't know it or they feel like there's some kind of social or legal exclusion that are creating barriers for treatment. They're scared to go to their healthcare provider. The healthcare provider might be scared to interact with them. They're scared to interact with their healthcare provider, and so they choose just not to seek treatment. As far as non-communicable diseases or infections go, there is an increased risk of fatality just due to that fear of going to the doctor. A lot of non-communicable diseases kind of get brushed to the wayside because they're scared about going in. There is also an increased risk for poor mental health, as well as the lack of accessibility to healthcare. 31% say that they lack accessibility, and 22% say that they avoid doctors for fear of discrimination. So between these two statistics, it can take a while for a transgender person to become really, really sick before they wind up going into the hospital. Other concerns would be for self-care, self-harm. The risk of suicide in transgender people is high, as well as the risk of self-harm, and I will just leave those statistics there. The risk for harm by others is also quite high in the transgender community. 21% have reported hate crimes. 72 of those hate crimes are violent homicides towards trans women. There's also an increased rate of police violence and sexual violence as well in the transgender community.